Today, we're diving into a pregnancy complication called placenta previa. We're going to break down what it is, why we're seeing more of it, and this is the most important part, how modern medicine takes what sounds like a risky diagnosis and turns it into a manageable, safe plan for delivery.
Okay, so let's start at the very beginning. What exactly is placenta previa?
To put it simply, the placenta ends up in a spot that could block the baby's exit route. So think about it. The placenta is supposed to attach to the top or side of the uterine wall, but with previa, it attaches way down low, basically right over the doorway. But where the placenta is located is really only one piece of the puzzle. Sometimes the bigger issue isn't just where it is, but how deeply it's burrowed into the wall of the uterus. And that leads us to a whole related spectrum of conditions. This image shows it perfectly, the placenta accreta spectrum. Over on the left, you've got accreta, where the placenta is just stuck on too tightly. Then it gets more serious with increta, where it actually grows into the muscle of the uterus. And then there's percreta, where it grows all the way through the uterine wall and sometimes even attaches to other organs like the bladder. As you can imagine, this makes delivery incredibly risky. So how would you even know you might have this? Well, the number one symptom that doctors and patients look for is really specific. It's painless, bright red bleeding. And that's key. Unlike other issues, this one typically doesn't hurt. It can happen out of the blue, usually sometime in the second half of the pregnancy. Now, this isn't just a random, rare occurrence. Research is showing that it's actually becoming more common. So the big question is, why? Well, it turns out there are some clear trends contributing to this increase. So there are several things that can increase the risk, right? Like being older or carrying twins. But there's one factor that has become a huge contributor over the last few decades: having had a C-section before. The scar tissue from that surgery can make it more likely for the placenta to implant lower down in the uterus during the next pregnancy. And that link, it's a big deal. We're talking about a 60% increase in risk for placenta previa in your next pregnancy if you've had a C-section. That's a really important long-term consideration for what is now a very common surgery. And let's put some hard numbers on that. A major study in England looked at second-time moms. If their first baby was a vaginal birth, the rate of previa was about 4.4 per thousand. But if their first was a C-section, that rate almost doubles to 8.7 per thousand. The data couldn't be clearer. Okay, so that all might sound a little intimidating, but here is the good news, and it's really good news. Modern medicine is fantastic at diagnosing and managing this. So while the diagnosis can be scary, the path forward is actually really well established and incredibly successful. And the way they find it is usually during a totally routine checkup. You know that anatomy scan everyone gets around 20 weeks? Well, as you can see in this ultrasound image, checking the placenta's location is just a standard part of that exam. And get this is probably the most reassuring piece of data we have. For more than half of all cases found in the middle of pregnancy, the problem just solves itself. As the uterus grows and stretches upwards, it often pulls the placenta right up with it, moving it safely away from the cervix. So what happens if you're in the other half and the placenta stays put? Well, the game plan simply shifts. It's not about panic, it's about creating a safe, controlled birth plan. That means more monitoring, maybe some activity restrictions, and just getting everything ready for delivery that keeps bleeding risks to an absolute minimum. All right, so let's talk about how all that careful monitoring leads to the delivery plan. The main goal, always, is to get the baby here safely while preventing any major bleeding for the mom. If you have a complete previa where the placenta is totally covering the cervix, a planned C-section isn't just an option, it's a lifesaver. Because if you were to go into labor, the cervix dilating would tear the placenta and cause a massive bleed. A planned C-section just avoids that whole scenario. And the procedure itself is a highly controlled step-by-step process. It's all about precision and safety. The surgical team makes the incision, delivers the baby, and then manages the placenta and bleeding in a very systematic way. For really complex cases, like with a placenta accreta, they might even bring in a specialized surgical team. But it's not always so black and white, right? The medical guidance has gotten a lot more nuanced. So what happens if the placenta is close, but not directly over the cervix? Is a C-section always necessary then? And this is where it gets really, really interesting. For these low-lying placentas, a trial of labor can actually be a great option. Look at this data. If the placenta's edge is between 11 and 20 millimeters from the cervix, the success rate for a vaginal delivery is 85%.
And even when it's super close, within 10 millimeters, the success rate is still a solid 43%. And this is backed up by the experts. The big takeaway here is that a low-lying diagnosis doesn't automatically equal a C-section anymore. It's all about that crucial conversation between the patient and their doctor, weighing the specific risks and making a shared, informed decision together. So here's the bottom line. While hearing the words placenta previa can be nerve-wracking, it is absolutely a well-understood and manageable condition. Thanks to early detection with ultrasound and careful planning, the outcomes today are overwhelmingly positive.
And all this leaves us with a final, really important question about the bigger picture of maternal health. We know that C-sections are essential, life-saving procedures, no question. But as they become more frequent, we're also seeing these downstream effects, like a higher risk for things like placenta previa. It's a really complex balance, and it's one that doctors and patients continue to navigate every single day.